Recently, I met one of my student who was telling that he failed his first station in the AMC because he was anxious, and he knew everything in the scenario that was given, but he still failed. I had the same problem as well. When you stand in front of the first scenario, when you're reading outside the room, your anxiety levels will be extremely high. I was panicking as well. I knew that this will happen. So, this is something I have done so that, I will get over that fear. It's only during the first one or two stations you will have this. In case if you don't get over this, most likely you will mess up the first station. This will lead to messing up the second and third, and finally, like dominoes effect, you will fail the AMC clinical exam. So what I told myself is, I told myself that when you stand outside the room, you will have fear. When I'm standing in front of the first station, I will have fear. So I told this to myself that when I stand, I will have fear. So I'm not worrying about what the scenario is. I will stick to my ABCDE approach. Okay, so and this is what exactly happened. I was standing in front of the room. The scenario was something like this: a 58-year-old male has come to you with blood in urine. This was the easiest scenario you will ever get. But still, when I was standing reading, I had this fear. My hands were shaking. I was thinking, what will happen if I fail? What will happen if I don't pass? Many things were going at the back of my mind. But I clearly told myself again and again that I have to stick to my basics, which is just looking at ABCDE approach. Those who have purchased my course will know what ABCDE approach is. A is action words, B is blunder, C is common diagnosis, D is direction, E is enter the room with a smile. Okay, so I was sticking to the basics, which is looking for action words. Okay, in this particular scenario, John, 58-year-old male, came with blood in urine, were my action words. So I was looking for these action words, and see, once your mind is distracted, the fear will go away. Okay, so make sure you do that. Get some distraction so that the fear will not get over you. Once you are under pressure, once the fear gets in place, you will be in trouble and you will not be 100%. So make sure you have something like that. Make sure you tell yourself that I'm going to have fear. I know that this will happen. I know my hands will shake. I know my mind will be blank. You need to tell all these before you stand there, because once you stand there, that will happen. Then you need to have a plan B, which is when all this happens, this is what I'm going to do. So I hope this video has helped. Many students were asking me to do a webinar. So, over the past few years, I've learned lots of things, as a candidate doing role plays, as a candidate preparing for my exams. Then, over the past 8 to 9 years, I've been teaching for AMC Clinical. So, I'm doing a webinar where I'm going to teach you all the 3 secrets to pass the clinical exam. If you get these 3 secrets right, you will pass it. Okay, so on 2 p.m. Adelaide time, 1st of April, I'm teaching you this webinar. You can actually look for the link either in the first comment below the video or in the post either above the video. Make sure you click the link and enter your name and email address so that I will send you my 2 workbooks. So you will need to get these workbooks on the day of webinar. So I will be explaining, you will be writing down notes, and you will have an action plan. You will have a study plan. How to plan your day. What do you do in the morning? What do you do in the afternoon? How do you plan your week? And the 2 important secrets, which is already there on the screen. You can see that I've just blurred it. I'll be explaining about it, and once you have this secret, you will save time, you will not miss a diagnosis, and you will be extremely successful in the clinical exam. It's very, very important. It's a free webinar, you don't have to pay anything. And many people were asking me about my course. on the webinar, I will be giving you the course link as well. If you're interested, you buy it. If you're not interested, don't worry about it. But at the moment, I'm not selling my course. But if you want my course as well, you need to be on the webinar so that I can give you my link. So make sure you register and make sure you attend, because it's a very important thing. The 3 secrets I've learned over 8 years as a candidate and as a doctor, teaching doctors, writing exam cases. I'm writing 2 medical books. So during all this time, I've learned that these 3 secrets are the most important things for you to pass the clinical exam. So make sure you note your time and date. It's 2 p.m. Adelaide time. You might be in India, it might be a different time. You might be in Dubai, it might be a different time. So make sure you check the time and make sure you enter your name and email so I can send you the workbooks, and I will send you the webinar link. You can sit at home and listen to this. And believe me, after the 1.5 hour, 1 hour webinar, you will not have fear of AMC clinical exam. Trust me. So make sure you attend and listen to these 3 secrets.